That cozy feeling, stepping into a warm house from the cold, or just flicking a switch for light, maybe jumping in the car. These are comforts we barely think about.
Right, everyday things.
But inside those familiar moments, there can be this silent, invisible danger. Carbon monoxide.
Exactly. And that's our focus for this deep dive. Carbon monoxide toxicosis. We've looked at some sources that honestly shed critical light on this threat.
Yeah.
And it's not just for us, but for our pets, our animals too. It's information that could genuinely safeguard your well-being, your whole household.
Absolutely. So our mission today is pretty straightforward. We want to pull out the most vital info about carbon monoxide poisoning from these sources so that you, listening, come away feeling, well, knowledgeable, prepared, and really empowered to protect yourself and everyone you care about, pets included.
Right.
Okay, let's dive in. This silent killer idea.
Yeah, it's a very fitting term, isn't it? Because carbon monoxide, it has no odor, no color, and it doesn't irritate you. You just can't sense it. No warning signs.
None at all. It's produced when fuels containing carbon don't burn completely. Think of it like a byproduct of inefficient burning.
And the sources really spill out where this stuff can come from, like obviously fires, but also car exhaust and our home furnaces. Doesn't matter if it's coal, oil, natural gas, propane.
Right.
Even things like gas stoves, fireplaces, and I was surprised, some paint strippers or sprays.
Yeah, those too. And what's really crucial to get your head around is how this gas that seems harmless actually causes so much damage.
Okay.
When you breathe it in, it gets into your bloodstream, and there it binds really aggressively to hemoglobin.
That's the stuff that carries oxygen, right?
Exactly, the oxygen carrier.
Yeah.
But CO binds to it and forms this useless compound, carboxyhemoglobin, COHB for short.
Useless how?
Well, it effectively crowds out the oxygen. It takes up the spots on the hemoglobin that oxygen should be using.
Okay. So the COHB itself can't carry oxygen. It's like filling a delivery truck with junk instead of the packages it's supposed to deliver.
That's a good way to put it, yeah. So the blood's ability to transport oxygen to your vital organs, think brain, heart, is just drastically reduced. It leads to hypoxia.
Oxygen deficiency.
Oxygen deficiency, right. And it's not just that it takes oxygen's place. The sources highlight that CO has this incredibly strong attraction, this affinity for hemoglobin.
How strong?
About 240 times stronger than oxygen's attraction. So it binds much more easily, and once it's on, it hangs on tight.
Wow.
And what's more, the presence of the COHB, it actually makes it harder for the remaining hemoglobin, the stuff that does still have oxygen, to release that oxygen to the tissues.
So it's like a double whammy. It steals the spots and makes the remaining oxygen less available.
Precisely. It's a real problem. The primary effect, the immediate danger, is this acute cellular hypoxia.
Meaning the body's cells just aren't getting the oxygen they need.
Right. And that can become fatal very, very quickly. The research even gives a number. Around 1,000 parts per million, that's only 0.1% concentration for just 1 hour, can be lethal.
Just an hour. That really highlights the urgency.
It really does.
Okay.
And it's important to realize, too, even if someone survives a poisoning event, there can be long-term consequences.
Like what?
The sources mention things like potential damage to the heart muscle, cardiac necrosis, or brain damage, and even something called delayed neurotoxicity.
Delayed. Meaning problems show up later.
Yeah, exactly. Neurological issues can pop up sometime after the initial exposure seems to be over.
Okay. Now, you mentioned pets earlier. It's not just humans at risk here.
No, absolutely not. Our sources are very clear. Dogs and cats are equally susceptible.
Makes sense.
And the risks often mirror our own. A faulty furnace, a leaky fireplace, a radiant heater. If it's malfunctioning in a shared space, it affects everyone.
Humans and animals alike.
Mm-hmm. And the sources also point out some specific high-risk scenarios for animals. Things like kennels using unvented gas or kerosene heaters, especially if the ventilation is poor.
Right, trapped fumes.
Yeah. Or even transporting animals in vehicles that have exhaust leaks.
Okay, that's a really good point. So if the CO's in the air, anyone breathing it, they're at risk. How do we spot it then? What are the signs we should be looking out for?
Well, the signs can kind of differ depending on whether the exposure is acute, happening suddenly, or chronic, like a slower, lower level exposure over time.
Okay, let's start with acute. What does that look like?
With acute exposure, the sources say symptoms can come on fast, minutes to hours. Things like drowsiness, lethargy, being less alert, weakness.
General malaise only.
Yeah, and you might also see a fast heartbeat tachycardia and rapid breathing, tachypnea.
Try to get more oxygen in.
Exactly, the body's trying to compensate. The research also notes that sometimes difficulty breathing, dyspnea, or even seizures, those sort of jerky, clonic seizures, can actually happen before the animal seems really out of it or depressed.
Oh, okay. That's interesting. And are there really severe signs?
Yes, unfortunately. Deafness, serious incoordination, and coma. Those often mean a fatal outcome is likely. Yeah. Other acute findings can include low blood pressure, arrhythmias, weird heartbeats like premature ventricular contractions, and acidosis, which is an imbalance in the body's pH.
Okay. Now, what about that classic sign you sometimes hear about the cherry red skin or gums?
Ah, yes. Well, here's a crucial point from our sources. That sign is actually rarely seen in animals with SAO poisoning.
Really? So we shouldn't rely on seeing that.
Definitely not. Relying on that could be a huge mistake. It's much more common in human cases described historically, but not something vets typically see in pets.
That's a really important distinction. Okay, so that's acute. What about chronic exposure? You said that looks different.
Yeah, chronic lower level exposure can be much more subtle. It can lead to general symptoms like nausea, maybe vomiting, acidosis again, a cough.
Sounds like it could be mistaken for a lot of other things.
Exactly. It can easily mimic the flu or some other infection. You might also notice the pet or even a person just has low exercise tolerance, gets tired easily,
Hmm?
or maybe problems with posture, balance, the way they walk, gait disturbances.
And you mentioned deafness earlier.
Yes, interestingly, the sources mentioned deafness can occur in survivors of chronic exposure too. And it might be temporary or it could persist. Variable persistence, they call it.
So the symptoms are all over the place, really. Easy to overlook or misdiagnose. Are there any sort of historical clues or context clues that might point towards CO?
Definitely. The sources really emphasize the significance of knowing the history. Has there been exposure to car exhaust indoors, even for a short time, like 5 or 10 minutes?
Right, running the car in the garage.
Exactly. Or exposure to fumes from indoor heating devices, especially if they're known to be faulty or unvented. That kind of history should raise a big red flag.
Okay.
And as we touched on, building fires are incredibly dangerous. The sources highlight that CO levels can become lethal very, very quickly in a fire situation.
Right. So understanding the sources, knowing these varied signs, that's the first step. But let's unpack the causes a bit more. Why does this incomplete burning happen?
Well, the fundamental cause, as we said, is that incomplete combustion of carbon fuels. But why it happens often comes down to a couple of key things.
Like,
Poor ventilation is a big one. If the combustion byproducts can't escape properly, they build up. And similarly, blocked exhaust vents or chimneys. If the escape route is blocked, the CO has nowhere to go but back inside.
So maintenance is key there, keeping vents clear, chimneys swept.
Absolutely. And we keep coming back to cars in closed spaces, faulty furnaces, gas appliances, those kerosene space heaters. It really drives home the need for proper installation, regular checks, and good ventilation.
Yeah, and that fire statistic is stark CO reaching maybe 10% inside a burning building.
It's a terrifyingly high number. And one more point on risk. The sources note that animals, or people for that matter, with pre-existing heart or lung issues might be at higher risk.
Why is that?
Because their systems for carrying and using oxygen are already compromised. So any further reduction caused by CO can hit them harder and faster.
Okay, that makes sense. So let's say we suspect CO poisoning. Maybe the history fits, the signs are there. How do the experts actually diagnose it? Sounds like it could be tricky with those non-specific signs.
It definitely can be tricky. The sources list several other conditions that need to be ruled out, what they call differential diagnoses.
Like what?
Oh, other poisonings, maybe neurological issues like epilepsy, metabolic diseases like diabetes complications, things that can cause similar symptoms like lethargy, weakness, or collapse.
So it's important to get it right.
Crucial. Standard blood tests are usually a starting point. A CBC, biochemistry panel, maybe a urinalysis.
What might they show?
Well, one specific thing the sources mention is that an enzyme called creatine kinase, or CK, might be high. That can indicate muscle damage, which happens when muscles don't get enough oxygen, ischemia.
Okay.
And an ECG, the heart trace, might show changes too. Specific things like STT wave changes that suggest the heart muscle itself isn't getting enough oxygen.
Right. Now, you mentioned something, well, the sources mentioned something really important about pulse oximeters, those little clip things.
Ah, yes, the pulse ox. Very important point.
They measure oxygen saturation, but they might not be accurate here. Why?
That's correct. They can be misleadingly normal or even high. The issue is how they work. They measure how light passes through the blood.
Mm-hmm.
But unfortunately, carboxyhemoglobin, the CO, bound to hemoglobin and oxyhemoglobin, the normal oxygen-carrying kind, they absorb light very, very similarly.
Ah, so the machine can't tell the difference easily.
Exactly. It gets fooled, it sees the COHB, and basically counts it as if it were carrying oxygen. So it might report, say, 98% saturation, giving you a false sense of security, when in reality, a large chunk of that hemoglobin isn't actually carrying usable oxygen.
Wow. Okay, so you absolutely cannot rely on a pulse oximeter reading alone in these cases.
Definitely not. It can be dangerously misleading.
So what is the definitive test then? How do you know for sure?
The gold standard, the key diagnostic test, is actually measuring the percentage of carboxyhemoglobin, that's COHB, in a whole blood sample.
A specific blood test?
Yes.
Yeah.
It directly tells you how much hemoglobin is tied up by carbon monoxide. But there's a catch.
Oh.
The sources caution that COHB levels can drop back towards normal relatively quickly once the exposure stops, within a few hours, especially if the patient is breathing fresh air or getting oxygen.
So time is of the essence for testing too.
Absolutely. Prompt testing is crucial for confirmation. And it's worth knowing, where the nearest lab is human or veterinary that can actually run that specific COHB test. Not all labs can do it routinely.
Good practical tip. Are there other blood clues?
Yes, the sources also mention checking blood pH. It might be lower than normal, indicating metabolic acidosis because the tissues aren't getting enough oxygen and switch to anaerobic metabolism.
Right.
And lactate levels in the blood might also be increased for the same reason. And just to reiterate about oxygen levels, the PO2, the partial pressure of oxygen in the arterial blood, might actually be normal.
Even though the animal is hypoxic.
Yes, because PO2 just measures the oxygen dissolved in the blood plasma, not how much is actually bound to hemoglobin and available to tissues. So again, it can be misleading if you don't consider the COHB.
Okay, so diagnosis involves the whole picture, history, clinical signs, maybe those ECG or CK changes, and critically, that specific COHB blood test done quickly.
That sums it up well. And once you have that diagnosis or even a strong suspicion, the intervention is all about one thing: oxygen.
Restoring oxygen to the brain and heart fast.
Exactly. That's the primary goal. And the main treatment, according to the sources, is giving supplemental 100% oxygen.
How is that usually done?
Often through an endotracheal tube, a breathing tube, especially if the patient is unconscious or having trouble breathing. This floods the system with oxygen.
And how does that help exactly? Does it just provide more oxygen overall?
It does that, but the key mechanism is competition. Remember how CO binds so tightly?
Yeah, 240 times tighter.
Right. Well, by flooding the lungs with pure oxygen, you dramatically increase the concentration of oxygen molecules competing for those binding sites on the hemoglobin. It helps to essentially push the CO off.
Ah, okay. It speeds up the detachment of the CO.
Precisely. The sources note it makes the CO detach about 4 times faster than if the patient was just breathing normal room air, which is a huge difference when time is critical.
4 times faster. Wow.
Yeah. There's also a mention of a technique called eukapnic hyperoxic hyperpnea, basically increasing breathing rate and oxygen while keeping CO2 normal to help eliminate CO even faster. But 100% oxygen is the mainstay.
What about hyperbaric oxygen? I think I saw that mentioned.
Yeah.
Like in a special chamber.
Yes, hyperbaric oxygen therapy. That involves breathing 100% oxygen under increased atmospheric pressure. It's even more effective at displacing CO and getting oxygen into tissues.
So why is that used all the time?
The main issue, as the sources point out, is availability. Hyperbaric chambers just aren't widely available in veterinary medicine. They exist, but they're rare and specialized.
So realistically, prompt 100% oxygen via mask or tube is the go-to.
It is, and the key message is the urgency. Rapid therapy is vital to prevent permanent damage, especially brain damage like CNS malacia or demyelination and damage to the heart muscle.
And what about first aid before getting to a vet?
Absolutely critical. Get the animal and yourself into fresh air immediately. If they aren't breathing, artificial respiration might be needed if you know how. Then supportive care at the clinic, like IV fluids, helps correct that acidosis and maintain blood flow to the brain.
Okay. So oxygen is the main medication. Are there things to specifically avoid during treatment?
Yes, the sources caution against using any drugs that might depress breathing further. That would just counteract the efforts to get oxygen in.
Makes sense.
They also mentioned a time limit for the 100% oxygen, generally keeping it under about 18 hours to avoid potential oxygen toxicity, which is damage from too much oxygen over too long.
Right. Even oxygen can be too much of a good thing eventually.
Exactly. And it's really important to monitor the patient afterwards, specifically looking out for that delayed neurotoxicity we talked about.
Because signs might appear later on.
Mm-hmm. Neurological signs can sometimes show up or get worse days or even weeks after the initial recovery seems complete.
Okay. What's the typical time frame for seeing improvement with treatment?
The sources suggest that a significant response to oxygen therapy is usually seen pretty quickly, within maybe 1 to 4 hours, depending on how severe the poisoning was.
And if they don't improve?
Well, if signs persist beyond, say, 24 hours despite treatment, the prognosis, the outlook, is generally considered more guarded or poor.
Got it. And after they recover initially, what's the follow-up?
Essential follow-up involves monitoring their heart, lung, and neurological function closely. And the sources recommend limiting physical activity for about 2 weeks just to give the body, especially the heart and brain, time to fully recover from the oxygen deprivation.
Right. Rest is important.
Definitely. But ultimately, the absolute best strategy here is prevention, isn't it?
Has to be.
The sources hammer this home. Eliminate the source of the carbon monoxide, find the faulty appliance, fix the leak, clear the vent, and, crucially, install carbon monoxide detectors in your home.
Yes. Those detectors are vital.
They really are. Relatively inexpensive, and they provide that early warning that your own senses can't. It gives you and your family, pets included, that critical time to get out and get to safety.
And test them regularly. Right?
Yeah.
Like smoke detectors.
Absolutely. Test them regularly and keep up with routine maintenance on all those fuel-burning appliances. Furnaces, water heaters, stoves, fireplaces. Ensure proper ventilation. That's how you prevent the CO buildup in the first place.
Okay. So if we bring this all together,
Yeah.
the big takeaway from this deep dive really seems to be that carbon monoxide is this incredibly serious danger, precisely because it's silent and invisible. But understanding where it comes from, recognizing the often confusing signs in both people and animals, and knowing just how critical rapid oxygen therapy is, that knowledge is key to safety.
It really is. And the level of detail in these sources, I think it gives you a much deeper, more practical understanding than you'd get from just a quick news flash or a general warning.
Yeah, you see the why behind the warnings.
Exactly. It helps you connect the dots, the sources, the symptoms, the treatment, the prevention. You grasp the whole picture.
It definitely makes you think. I'm sitting here thinking about my own house now. Do I know all the potential CO sources? When did I last test my detectors? It's given me some homework.
And that's really the value of digging into this stuff, isn't it? We tend to focus on dangers we can see, the obvious threats.
Right.
But the invisible ones, like CO, can be just as dangerous, maybe even more so because we're not naturally alert to them. Which kind of leaves you with a thought, doesn't it?
What's that?
Well, it makes you wonder, what other silent risks might we be unknowingly exposed to in our everyday lives? And what steps can we actually take to understand them better and, protect ourselves?